many of us have ever attended the hospital or taken someone, or someone who has gone to the hospital and it took so much time for them to be taken care of or to be attended to? Maybe they needed to go through a screening, they needed to go through a scan, and it took way more time than maybe the time you had allotted it for or the time you expected. Now, in our picture here, we have two different people with two different conditions. We have James. James has been suffering from a backache since the last 3 days, and he is going to be seen at the hospital. And then we have Mary here. She needs to be seen too. As we can see, it looks like she got into a car accident, so she doesn't have a choice but to attend a hospital for medical care. All these two people will go through scanners, they will be scanned, they will be treated. But how do we make sure that Mary and James get the proper treatment in the shortest time possible? This brings me to my problem statement. With the increasing cost of healthcare, a lot of people do not want to go to the hospitals, or if they go to the hospital, they don't want to spend so much time there. And also we see that the hospital too, they want to make the revenue. So how do we make sure that the hospitals make the revenue they want, and also the patients are attended to in the shortest time possible? Now, my data, I collected it from OECD countries, which is short for Organization for Economic Cooperation Development Countries, which are countries that have come together to share economic policies to help with economic growth. My name is Esther Karanja. I'm a Power BI developer at Colaberry, and the project I'm presenting today is healthcare investment and health and length of hospital stays. In my data dictionary, my main table was hospital stay and investments, and that is my main table. And then I created measures which I used to come up with my insights and my KPIs. Also, I created a waterfall table, and this waterfall table just shows the decrease and increase in the KPIs year over year. And then we have our refresh days, just when the data are being refreshed. This is my dashboard. And in my dashboard, I'm just gonna go over the KPIs. Our main KPIs, we have the hospital stay, we have MRI units, we have CT scanners, and hospital beds. And then the sub KPIs are just all year over year differences. And we have the year over year for hospital stay, year over year for MRI units, year over year for CT scanners, and year over year for hospital beds. Now, I have my slicer here, and it's just slicing by year. So if you want to view specific years, the slicer is gonna help us show specific years we want to look at. Now, one thing I would like to point out, as we see here, the year over year for hospital stay, when the number is negative, we see our indicator is green. The reason behind that is because we don't want the patients to stay longer than they need to in the hospitals. So the lesser the number of days spent at the hospital, the better it is for the patient. So that's why we have it as green when the number goes below 0. Now we have 5 charts. I created a hospital stay by year chart, and here we're just looking at how the hospital stay was from the year 1990 to the year 2020. And then the second chart is hospital stay by region. And here we have the capability of drilling down. So the specific region, you can drill down to whatever region you want to view. The next one, we have hospital stay by location. And in this one, we are showing the hospital beds. The color represents the beds. And then the size of the bubble represents the hospital stay year over year. And then we have the waterfall chart. And with the waterfall chart, as I mentioned up here, when the number is negative, it's a green indicator. We are facing down. Here is the same thing too. When there is less number of days spent at the hospital, the indicator turns green. And the last one, we have hospital beds by region. And this just shows the number of hospital beds in each region. And also here, we have the capability of drilling down to the specific region that are represented, the specific locations that are represented. Now, I want us to focus in 3 specific years, and I'm just gonna select them up here. I'm gonna filter the data. So the 3 specific years I want us to focus on, and we'll grab our insights from here too, is from the year 1995 to 1997. As we can see here, in the year 1995, the hospital stay was negative 2%. And then we see the MRI units didn't have any much investment, the CT scanners and hospital bed. But in the year 1996, we see a hike in the hospital stay. After the hike, they had to invest more in the MRI units, the CT scanner and hospital beds. As we can see with the numbers, they're triple-digit numbers. And after the investment, we can see it having an impact with the hospital stay because the number of days spent at the hospital went down by negative 15%. So with that said, we can totally say that in the year 1995, when the hospital bed, the number of hospital stay was lower, they did not invest much. And then when it came to 1996, when it went up, we see that by investing in the CT scanners and MRI units and hospital beds, it had an impact on it because in the following year, we see the number going down. So we can safely say that investments here played a major role to bring the number of hospital stay down. Now, let's focus on a region like East Asia. So East Asia has the highest number of hospital stay. And we can see that from this chart here, the East Asia is following the same routine. In the year 1995, East Asia days of hospital stay was lower, but then it increased in 1996. And after the increase, which was very high, they had to invest heavily on MRI units, CT scanners, and hospital beds. And we can see that having an impact the following year because the number of hospital days spent at the hospital went down with a big number. Let's go back to our original data, our original dashboard. In our original dashboard, we see the Southwest Asia has the lowest average number of hospital days. We can see it's averaging at 4.46. Now, with that said, if you look at the chart here, you see that in Southeast Asia, they look like they're always investing on the CT scanner, MRI units, as we can see from the chart. And the more they invest, the less the number of days spent at the hospital. So we can say that Southeast Asia is doing something right to help keep the number of hospital stay down. Here, as we look at the hospital beds, and still focus on Southeast Asia, so choose a year like the year 2008, the number of hospital beds here was 8. So the following year, we see they increased the number of hospital beds to 9. So this has an impact to the number of hospital days spent at the hospital. So with that said, we'll go back to my recommendations. Since we have seen that the MRI units, the CT scanners and hospital beds have an impact on hospital stay. Now let's look at what recommendations we have to help cater for the number of days spent at the hospital. The first suggestion I have is to increase healthcare investments. As we've seen in our dashboard, increase in the investments it affects the hospital days in a big way. And then implement targeted interventions. As we've seen with the example here of James and Mary, James, his problem is not as bad as Mary's. So we need targeted intervention. Whatever is done for James should not be the same thing done for Mary. So we should have like care pathways, multidisciplinary approaches to different patients so we can minimize the number of stays at the hospital. Because as we can see now, is 6.18 days to 7.1 days average. Then share best practices and benchmarks. Like the country like Turkey, as we have seen, it has been able to maintain its numbers of hospital days at 4.46. We need to know what is Turkey doing that we are not doing, or the countries that have high number of hospital days, they need to figure out what Turkey is doing and they are not doing. And because they are all together in that organization, I think Turkey will be a best bet for them to go for advice and see what they can do to decrease the number of hospital days. That's it from me. If you have any questions, here to answer them.